Honorable Minister Shri Pratap Rao Jadhav Sir, Minister of State for Independent Charge of AYUSH and Minister of State for Health and Family Welfare, my colleague secretaries from DPIT, Skill Development Ministry, AYUSH, and Department of Empowerment of Persons with Disabilities, Honorable Member Health, NITI Aayog, and distinguished panelists and dear stakeholders. After the very inspiring address of Honorable Prime Minister in the morning, we had 7 parallel sessions in which we have discussed a variety of subjects: scaling up of allied health professionals, setting up enhanced to and upgrading the mental health institutes, strengthening emergency and trauma care centers, training 1.5 lakh caregivers, setting up of 5 regional medical hubs, setting up of 3 new All India Institutes of Ayurveda and other Ayush upgrades, and the Divyang Sahara Yojana. There have been very vibrant discussions, and 98 panelists have participated in these 7 sessions, with over 5,500 participants who joined us through the NIC network. Since these topics are interconnected, we are extremely grateful to Dr. V.K. Paul, sir, Honorable Member Health of NITI Aayog, for agreeing to present to all of us who are there today in this webinar the outcomes of these discussions in a very comprehensive and holistic manner. Sir has always been a leader in the field of the social sector, and I'm sure that he will give us the larger picture as also the specific outcomes that have come out from this budget webinar. Over to you, sir.
Thank you very much, ma'am. Thank you and good afternoon. Namaskar. Honorable ministers, respected secretaries, dignitaries, senior officials of Government of India and state governments, academics, and distinguished participants, I'm truly honored to be bringing to you the summary of proceedings of 7 fascinating breakout sessions. It's a difficult task, but we have the team of very competent colleagues who have put together the synthesis of all the different sessions. I'm trying to bring to you the messages, the voices from our distinguished participants this morning, and above all, ideas on implementation of the budget announcements in letter and spirit. I'm going to start with the session 1, namely the session on scale up of allied health professionals. Next slide, please. Thanks. The paragraph 53 of budget stated, and I quote, and this needs to be stated so that we're clear about how we all will translate this intent, this commitment into action. Existing institutions for allied health professionals will be upgraded. New allied health professional institutions will be established in private and government sectors both. This will cover 10 selected disciplines, including optometry, radiology, anesthesia, OT technology, applied psychology, and behavioral health, and add 1 lakh PHPs over next 5 years, unquote. That's the intent. Next slide, please. The discussion focused on 5 major areas. 1, that there is a need for this task to be accomplished. There is a need for deep and comprehensive stakeholder consultations. As you would appreciate, this sector, AHP training sector, was essentially unregulated. It's only with the new act that now we have a national commission on AHPs, and we are walking into the early stages of formal regulation. And therefore, while we bring the implementation of regulatory framework, bucket number 2, it's important that we talk to people. how do we move forward with this ambitious goal? So, engagement with state governments, private institutions, academics, health sector leadership is the first major input that we have from the proceedings since morning. About regulatory framework, as I mentioned, we are in the early phases of implementing the regulatory framework, very ambitious, uh, because we have the opportunity of 3 to 4 to 7 million jobs in this area. And therefore, we have to go systematically. We have to undertake an approach which is rational, stepwise approach. We have to focus on faculty qualifications. We have to focus on the infrastructure and laboratory standards. And also, we are informed by our eminent speakers today, by our panelists, that we should think of team-based approach. That we should think that with the expansion of the infrastructure in the public as well as the private sector in recent times, we are looking at teams working together alongside the nursing professionals and doctors to deliver quality healthcare that we expect to build in future. Therefore, think with teams, and that would be one paradigm through which we should act and enable the regulatory framework to achieve that goal. Third element of the discussion was very critical. What is the true demand of various categories of allied health professionals? There are scores of categories of health professionals, from physiotherapists to dietitians to dialysis technicians to clinical psychologists and so on and so forth. What is needed to be careful about the demand side so that when we undertake training, there is a job market, there is employability, and therefore a critical, well done assessment of the demand is very important. And of course, that should be repeated from time to time to see dynamically how we need to proceed. So we need to undertake that through job market trends, looking at also institutional capacity available for training. And we would like the awareness of allied health professionals to be enhanced so that there is a traction on the part of the potential candidate and the interests of the state governments and so on. And again, very important, we wish what we have been told by our panelists through the discussion is that there is a huge unmet need, and the numbers that people mentioned was to the tune of 3 to 3.5 million. Such workers are required in the country. And previous estimates from high level expert group were as many as 7 million. So huge potential for service, huge potential for improving healthcare, huge potential for employability is there in this space, and we will keep that in mind. Private sector partnerships critical, not only to identify the demand in the private sector and to use the workforce there, but it's also very important for private sector engagement to be partnering the expansion of courses, improving quality of these courses, and indeed working with the government to strengthen the government capacity in training such a large number of allied health professional candidates. In terms of strategy, operational strategy will be required for institutions. We are visualizing upgrading of the existing institutions to the desired standards. We are also visualizing new allied healthcare programs and institutions. And we also note the fact that currently much of the capacity lies in the private sector. The government has to play its own role, one, to expand that capacity and optimum distribution of this capacity across the nation, but also have high level centers of excellence in this field so that they serve as the benchmark for all of us, including the private sector. Next one, please. The strategic way forward, 4 points, 4 broad points were made. One, galvanize the regulatory system and institute regulatory reforms, and undertake this through the phased expansion of the education system, standardizing that system, strengthening the institutions, strengthening the quality of those institutions, strengthening their connect with the certifying accrediting bodies such as the universities. Be mindful of the fact that we, as I said, are in the early phase of implementing the regulatory system, and therefore a nimble, flexible, graded, but robust approach to regulations should be instituted. And we need help on this from all the stakeholders because this is building the highway for allied health professional system in our country with all the potential benefits that it has, to which I made an earlier reference. Faculty development is a very important area, and our participants highlighted that. We must appreciate that the current pool of faculty is relatively limited. We have to be training and recruiting and enabling the new educators in a big way. We will have to think about how to share faculty across programs in a given institution and perhaps also share faculty across institutions to be helpful in this very important phase of national development in this area. We will have to use standardized foundational courses so that if I do one course here, it can be done in a collective way, and then specialized courses can be done at the top. So we will need innovations in faculty development and in pedagogy. One important area of work would be, and an opportunity and a solution is digital learning platforms. So e-learning platforms ease our work to an extent for sure, but we must not compromise the practical capabilities. The participants highlighted that it's ultimately about the clinical, practical skill, communication skill, effective skill, and not just the knowledge. And in order to ensure that we leverage the digital system and go for hybrid learning where practical learning is coupled with it. Digital libraries of resources will be very useful, and the government will work systematically to build this digital learning ecosystem for AHPs. In terms of infrastructure upgradation, apart from upgradation, the optimization is extremely important. We should be sharing our laboratories. So in an institution, the same lab can be used in the morning for nursing profession and in the afternoon for, say, medical technology laboratory assistants. We must use national resources optimally. We will create new ones, but this is the voice we heard from our panelists. Digital academic resources will be useful in this regard. Partnerships with hospitals, within hospitals, across diagnostic centers are solicited. And please, we need help from all the participants, the private sector, the NGO sector, the civil society, and other, other university higher education systems to please support such opportunities. Even universities have microbiology department, for example, and pharmacology department, and other such, and clinical psychology in their own way. So we will need these wide-ranging partnerships. In principle, we are highlighting the fact that existing resources to be used directly and to be used through repurposing. This will be a very important enabler of translating the mission of the budget statement into action. Next slide, please. Honorable participants, I now move to the second theme, which is to train 1.5 lakh caregivers. This is according to para 54. And the para 54 presented here talks about a strong care ecosystem covering geriatric and allied care services. And a variety of NSQF aligned programs will be developed. A variety of NSQ programs, not just one program, as you will appreciate. There will be different levels and different mix of programs within the space of care economy. That's the intent. And it talks about multi-skilled caregivers. It talks about focus on wellness, yoga, and of course connect with medical and assistive medical care as well as assistive devices. And the commitment is to produce 1.5 lakh caregivers in future. In order to achieve this ambitious goal, next slide please, 6 themes emerge as the first set of the recommendation from our panelists. Firstly, we will have to build strong national caregiver training pathway, building on what we have already. And here we will strengthen the National Council for Vocation and NCVET system, uh, and build the standards. First and foremost, develop the standard. Then standardize the curriculum across the ecosystem, and then to ensure that multi-skilling modules on healthcare, wellness, yoga, digital, emergency response, communication skills, all this is built up, and work with centers of excellence in scaling up the training in this area. We will need centers of excellence to represent the very best that can be, and that should be then emulated by others. So a strong national caregiver pathway will have to be developed. Second, we will scale training delivery to meet the 1.5 F target. This will have to be done again by leveraging the existing resources in a very big way. IITs, NSTIs, polytechnics, a JSS system, accredited private partnerships, and so on and so forth, hospitals and the universities in their own way. And this will, while we plan this, we shall keep in mind the regional demand that is expected in this area, and ensuring thereby that we have the resources available, regionally distributed, available in a regionally distributed way, so that the students do not have to go very far in every case, in every which way. The third discussion point that emerged was enhancing employability and career pathways. Extremely important. This voice was heard over and over again that we need to define the pathways for employability. We should use credit framework for academic mobility, and we should particularly collaborate with hospitals and private sector institutions to be able to find placements for the graduates and the certified individuals coming out of the training system. An important point made by the participants was that the caregivers should could and should visualize progression of their careers into what we may like to call, for want of any other word, higher forms of professionalism. So can they move into get through career paths to nursing or allied health system? This suggestion has come, which should be examined, and this has been duly noted. The fourth point is with regard to strengthening trainers and assessors. As for the HP, our faculty pool available today is possibly around 500. We will have to jack it up to 3,000 to meet the aspiration of the budget announcement. We will need master trainers in specialized areas as well, palliative, disability, geriatric, to be able to impart training to the potential trainees. Assessment protocol focused on knowledge, focused on psychomotor and clinical skill, and focused on communication and empathy skill will be required, and we will have to upgrade the training infrastructure with the use of devices, technologies, simulators, and so on. The fifth point is with regard to digital platform, stating the obvious. A training program of this magnitude is facilitated hugely using the digital platform, the digital systems, as was the case made for HPs. We will use digital platform such as the Skill India Digital Hub for registration and certificate. We will create a national registry of skilled caregivers and truly leverage all the digital platforms that are needed for this work to be accomplished. An important point that emerged was that there is a specific skilling ecosystem in different states. For example, in Northeast, there is a special potential of cultural suitability, high women participation, and certain kinds of caregiving and care demands are known to be connected to the ecosystem in the Northeast. In southern states, nursing linked caregiving system is available, particularly for global placement, but also their uptake nationally in the entire country. So this should be leveraged. And one recommendation that came up was that we should undertake regional mapping exercise to see which areas offer from the potential candidate specific potential for skilling opportunity that should be created, that should be honed and nurtured for that specialized opportunities within the country and beyond. Next slide, please. In terms of way forward, previous slide, please.
Previous.
Yeah,
Previous.
yeah, this one. In terms of way forward, additional points are as follows. We will need for the global market international standardization using qualification packs which are linked to the national classification of occupation. Very important. We need these qualifications to be understood in the same way by other people and also across nation through the international standard classification of occupation codes. And we will have to use some frameworks such as the European skills, competencies, qualification, and occupational framework. We must be mindful of the fact that the trainees, that the trained manpower that comes out of this system should be standard, should have compatibility with the global standards, so that should that opportunity is required, is offered to an individual, there is no hang up because our qualifications are not standard. Very important point. In terms of enabling global mobility, the point number 2 on the slide, we need to align Indian qualifications with global standards. We need to introduce language courses. We need to strengthen partnerships with the Ministry of External Affairs. What it means is that we should be mindful of the frameworks that apply to global mobility, which which will which will be provided, which are provided in the public domain and otherwise facilitated by our Ministry of External Affairs. Need to work in tandem with them, and also to use the right pathways for recruitment, counseling, placement, and of course, social security, etc., so that when our candidates go abroad, they are protected and they are respected and they are secure and safe. And very important point came up from discussion was apprenticeship training through private players. What was highlighted was that quality training of apprentices through private players is a huge need. We would request the private sector to come forward. This suggestion came very forcefully to absorb the trained manpower, but equally importantly, please partner with the training institutions to provide apprenticeship in real life situation for their skills to be enhanced. What they gain through these skills, through them, are for the service of the nation. So that partnership is therefore very much needed. Focus on healthcare sector opportunities. This bullet means that again, in particular, this expectation of apprenticeship opportunities is expected from the health sector, the government health sector, of course, which is easy for the government to implement, but also from the private sector system, the hospital, the diagnostic centers, and so on and so forth. So this will be a very important enabler of this aspiration. Then we have 3 quick points: ensuring quality training infrastructure. This would require state-of-the-art training centers, accreditation norms to be followed, regular audit systems so that we ensure the benchmarks. Very important point also relates to the inclusion of women empowerment. The government visualizes this ecosystem to be hugely women-centric in health profession, and particularly for the nursing and allied health professionals. Equally importantly, for the caregiving profession, we believe women participants have a great potential, and therefore efforts should be made to make sure and to actively promote training uptake by women, training uptake by previously informal caregivers or presently informal caregivers and marginalized groups, and therefore, if required, flexible formats, modular format, and blended learning formats may be used. In order to make sure that we deal for international market in a safe, secure way, it is important that domestic and international job opportunities should operate through a verified pathways, and we must connect certificated employers to the potential employees, build partnerships across across the hospitals, care homes, and international recruitment agencies, and indeed enable transparent placing system. These are the inputs we received from very wide-ranging discussion on this budget theme. Next one, please. The third theme related to developing 5 regional medical hubs, para 55. This budget announcement relates to promoting India as a hub for medical value tourism or medical tourism services. Our Honorable Finance Minister had proposed to launch a special scheme to support states. So the states have a responsibility in establishing 5 regional medical hubs in partnership with the private sector. These hubs will serve as integrated healthcare complexes that have medical component, educational and educational and research component. A strong emphasis on AYUSH and medical value tourism facilitation and infrastructure for diagnostics, post-care, and rehabilitation is envisaged. These hubs will provide not only care but also diverse job opportunities to health professionals and indeed job opportunities to the supporting professions and systems as well. Next slide, please. This is a summary of discussions on this topic. Next slide, please. Yes. Next slide. We'll wait. Yeah. If you look on the left side, the main headings are on the left side. The discussions led to the following 5 thematic recommendations. One, that in order to establish these 5 regional hubs, comprehensive stakeholder consultation should be taken. This is, in a way, a new initiative for the country. Right now, the medical value tourism hubs have been created they have evolved from the existing systems. Here, we are talking about specific hubs which are fully integrated, fully functional, extremely welcoming. It's a new model for India. Therefore, consultation with the government, with healthcare institutions, industry, financial institutions, developers, as well as even the potential users from other countries should be contacted and involved in discussions. Discussions on tourism potential, clinical infrastructure, sustainability, and so on. The second point relates to creating a conceptual and institutional framework as to how a regional medical hub should look like. And it should keep in mind the institutional structure and land planning as well as partnership models and opportunity. The third point relates to identification of potential pilot locations. So once we've understood what all it will take to develop such medical hubs, we then the government will offer to the states to look at potential hubs based on land availability, connectivity, healthcare ecosystem, policy support, other incentives that the states may like to offer. And then that takes us to the fourth point, namely developing a formal implementation plan, which has all the parameters and which takes into account all the expectations with regard to medical value tourism. And of course, it incorporates hugely the digital health system as well. Moving from there will be the fifth point, namely the discussion that centered on roadmap for project development, developing the full-fledged project development and implementation roadmap with collaboration from public and private stakeholders. So the formal vision and formal project reports will then be created. In terms of way forward for this budget announcement, 5 points. Next one, please. First, we will need to, first is a fundamental principle that this is an integrated system that's being created. It's an integrated healthcare ecosystem. It has tertiary, quaternary care and diagnostic services. It has medical research and health professional education as a part of this. Very important because such a resource should be used for capacity development in niche areas, including care, the skill part, as well as health professionals, applied health professionals, and indeed the specialists and super specialists. Coupled with this is the third principle, namely focus on wellness and focus on patient services and patient satisfaction. So this is the first part that this is to be seen as delivering on these parameters. The second part of our way forward is to be able to create an ecosystem for coordination, central governments, state governments, healthcare institutions, developers, tourism sector, and other stakeholders who will use these mini campuses or these campuses as sites for care, sites for medical value tourism, and sites for overall health care and wellness care as well. States have to be clear about their planning of the land, connectivity, and the kind of policy support that they would be willing. Thirdly, a clinical ecosystem, which is at the core of this initiative, has to meet the highest standards. So the key words are standards, quality, accreditation, global benchmarks, and indeed strong digital health integration to be pervading through through this integrated regional medical hubs that are being envisaged. The fourth point is with regard to connecting it to the tourism paradigm. The vision we heard from our participants is to make India and these hubs as preferred global healthcare medical value tourism destination. Preferred, the most preferred medical value tourism hubs is the vision. And therefore, what is needed is to create, as a start, a very comprehensive portal which talks about these services. It talks about what will it take to reach here, who to contact, how to do pre-travel consultations, how to get facilitation for visa, and how to be looked after not only as a patient but also as a family, and what opportunities are there for the other elements such as tourism. All that should be available on a portal. Previous attempt has been made, and for here in India, portal has been created, but we will have to go for more comprehensive and more visible and more inspirational portal, and that is the need of the hour we heard from our participants. We need to keep in mind the hospitality part, patient facilitation. We will have to keep in mind the satisfaction of the travelers who come to our country for seeking the care there. And like always, we will welcome our guests through the spirit of Atithi Devo Bhava. The fifth point is in regard to creating a financing and investment ecosystem and sustained ecosystem. Here we will need public-private partnership. We will need to examine blended financing model, and we have to be mindful of the fact that in future too, these mega hubs that would be created should remain financially sustainable and making sure that not only they serve the people, but they create an image of our health services of global standards. A point was also made that insurance portability of our visitor as well as insurance facilitation would be an important area of work to be done. A point was also made additionally was that while we develop the regional medical hubs, some of these principles that are enunciated in this slide and the previous slide should also be used for the existing medical value tourism ecosystem in the country, because by these new hubs come, there is already an ecosystem of medical value tourism, and to get the best out of that system in terms of the image of the country, in terms of the service that we provide to the global community, and in terms of the earning and employability, the principle enunciated here, the family set, should also be used for the current ecosystem. Next slide, please. I now move to section number 4, and this relates to creating 3 new All India Institutes of Ayurveda, and it also deals with Ayush upgrade under para 58, 1, 2, and 3. Next slide, please. The discussions centered around the 3 subpoints of the announcement. It relates to strengthening Ayush infrastructure for educational research and tertiary care through creation of the new All India Institutes of Ayurveda. It also talks about augmenting quality of Ayush medicine products and its global reach through a network of strengthened drug testing laboratories, strengthened GMP compliance, and very importantly, MSME handholding and support, as well as quality certifications. This is the intent of the announcement, and for this, resources will be available. But we need to deliver on the expectations of ensuring that the Ayush medicines and products match the very best in the world and are accepted by the world in that spirit. We need a specific mention has been made to upgrade the ecosystem of the WHO Global Traditional Medicine Center at Jamnagar in multiple ways, and I'll come to that in the next slide. And there's also an overall intent and vision that Ayush system should play an increasing and effective and significant role in achieving the goal of universal health coverage for our nation. Next slide, please. The way forward. Establish three new Anya Institutes of Ayurveda as centers of excellence for specialty care, integrative, integrative tertiary hospitals as serving as integrative tertiary hospital, research sensitive departments, research intense departments, global collaborations, and surveying the larger goals of health of the states and union territories. Also, there's a proposal to develop regional advanced drug testing laboratories, five of them, supported by state and private laboratories as spokes, in order to create an ecosystem for better quality Ayush drugs. And here, to leverage facilities under Pharmacopoeia Commission is one expectation. And this Pharmacopoeia Commission for Indian Medicine and Homeopathy and Ayush Research Council, coupled with Ayush Research Council, will serve the purpose of ensuring that the standards are written, standards are implemented, and standards are supported for the provision for for the Ayush products to be produced in our country. The third point relates to strengthening the manufacturing ecosystem through regulatory training, MSME support and handholding, and targeted infrastructure upgrade. The fourth point relates to expanding the Ayush Aushadhi Gunvata scheme and operationalize the Ayush quality mark to improve standardization and export competitiveness. The fifth point relates to upgrade of the WHO Global Traditional Medicine Center ecosystem at Jamnagar in multiple ways. It should include, as a part of that advancement, through the budget announcement and budget resources, advanced Ayurveda hospital, global traditional medicine museum, herbal garden, a state-of-the-art super center for yoga, and resources to be devoted to research, training, and medical value trap. So this is the original vision of the WHO Global Traditional Medicine Center, and the budget announcement aims at now translating that vision into reality through strengthening of this center in multiple ways. Also, there's an aspiration to develop Jamnagar as a UN family duty station so that UN staff from various places can come here and visualize an experience, have lived experience of this hub and make use of the offerings of IU system for health, wellness, and rejuvenation. Next slide, please. Section fifth dealt with setting up of second NIMHANS and upgrading the two mental health institutions under FERA 87. The intent is to strengthen tertiary mental health and neurosciences care in the country and address regional imbalances in access to advanced brain and mind sciences. And therefore, a second National Institute of Mental Health and Neurosciences, NIMHANS, is being envisaged in North India as a center of excellence in clinical care training, research, and digital innovation. Next. We heard from the participants the following vision for this particular budget announcement for NIMHANS in North India, modeled on NIMHANS Bengaluru, which is the benchmark we are so proud of. NIMHANS 2 will be located in North India. NIMHANS 2 will be an INI backed by a legislative procedure. It will be a greenfield structure based on the gaps noticed in care and availability of land, etc. A physical infrastructure, a strong, comprehensive physical infrastructure is visualized with super specialty services, residential structures, and multiple departments, and so on. Human resource augmentation. This will lead to human resource augmentation in a very big way as a center of excellence, as NIMHANS 1 has done, by running advanced courses, new courses, flexible courses, including courses not just for neurology, neurosurgery, and psychiatric sciences, but also for clinical psychology and other allied courses supporting the allied health professional ecosystem as well. And the nation expects high quality, forward looking, path breaking, cutting edge multidisciplinary research emanating from this new proposed institution. There are two other institutions that could be strengthened under this budget announcement resources. One, CIP Ranchi, and second, the LGB Tezpur Center. These are the existing institutions of mental health. They will be upgraded to regional apex center after due assessment of their gaps and based on the gaps, convert them into centers of excellence for our nation. Next, please. In terms of implementation strategy, we will be required, and it's clear that there will the need for amending the NIMHANS Act of 2012 to allow for additional enhances. Uh, the one that has been announced as a starting point. A high-level committee will be required alongside stakeholder consultation to be able to visualize the scope, the full scope and the structures of NIMHANS as well as the scope for accreditation of the CIP Ranchi and the Tezpur institution. So systematically identifying what needs to be done in order to transform the two latter institutions that I mentioned to regional mental health centers of excellence. We will have to look at possible locations for the new NIMHANS. Detailed project report will have to be created, both for NIMHANS 2 as well as for regional apex institutions that have been announced. EFC notes will be prepared. Uh, Close attention will be paid to human resource policy to ensure that we attract the talent and we are able to retain the talent for these very important centers of excellence of our country. And the work will be awarded, academic courses started. That's the vision. And we got suggestions from our participants in each one of the in more detail, which have been recorded. Next one, please. Session 6, or the sixth theme, was strengthening emergency and trauma care under para 88 of the budget announcement. This aims at strengthening and increasing capacities for emergency and trauma care at district hospitals. Next one, please. The in order to translate the intent of the budget announcement into action and transformation, we will need to undertake an assessment of the district hospitals for the available emergency and trauma care services. Based on that, a comparison will be made with the expectations and the standards, especially the IPHS norms for emergency and trauma care for district hospital. And this gap analysis will then pave way for infrastructure strengthening of these hospitals and to also address other inadequacies such as the human resource gaps and so on. We will have to develop technical standards and model RFPs for facilitating urgent, quick, and quality procurement of emergency drugs and equipment. We will have to create standard operating procedures for emergency care because emergency care is about time sensitive 24/7 work and it works on standards of care, standards of triaging, standards of quick assessment, protocol driven care, and so on and so forth, and integration with other services in the hospital and across hospitals. So SOPs are very important. So are the KPIs of the emergency and trauma services. We will need to develop training modules for the providers, including doctors, nurses, and paramedical staff. It emerged from the discussions and experiences of multiple states, in particular Andhra, Kerala, and Tamil Nadu, as well as experience from research, that digital systems are essential to run efficient emergency and trauma care services. And indeed, we have extremely valuable experience already available from multiple states. So digital backbone will be developed, drawn upon from the existing systems, dashboard that track the journey of the patient, the journey of the ambulance, as well as dashboards which allow the managers and allow the people to see how uh, patient is moving through the care pathway in the facility would be extremely useful and bring in quality, accountability, and efficiency. This will be a very important area of our work. Important point emerged that the care, emergency and trauma care needs to be seen through the prism of integration with other schemes and integration with the clinical care in the same district hospital across, say, the labor room, the operation theater, the critical care block, or the intensive care unit, and so on. And also, there is an element of intersectoral synergy in order to bring down preventable mortality in emergency situation, for example, working with the NHI. So integration emerged as a very important area of our work, and suggestions have been made by our panelists on this. Next one, please. What we will need is training doctors, nurses, paramedics, and this training would be embedded in the certificate courses and degree courses and diploma courses and skill courses, but also in-service training would be required. In-service training would be of various types, including the National Emergency life support kind of a training programs, short courses. Again, the participants highlighted the need for practical skills, efficient skill, decision-making skill, working as teams, and working using the SOPs. These will be the ingredients of such training programs. In order to ensure that the infrastructure that we create, the services that we create meet the standards. So compliance with national quality assurance standards and other benchmarks will be ensured from the very beginning. We need to ensure a continuum of care across the ambulance system on the one hand and so on, but particularly in that location with with the critical care blocks and critical care units that have come up under PMA beam as a very important area of our work, because this newly created resource must be leveraged and connected with the emergency and trauma care. Appreciate that the emergency room is for immediate care, for triaging, immediate care, imaging, making a diagnosis, and after that, the patient moves to different area of the hospital, a trauma unit or a critical care unit or a delivery room, or refer to another institution if required. And of course, if further treatment is needed, the patient goes home, that acute first aid treatment and then reports for care later on. Having been satisfied, the patient to be able to satisfy the patients who come in need in emergency and trauma care is a very important element that the panelists highlighted. We expect our system to be very humane, caring, empathetic, because our families and patients are tense at the time, and that will be an important part of our work in ensuring a functional and caring district health system. Important point is that we now have emergency response support system in most of the states where the entry is through a common number 112. A strong recommendation emerges that the emergency and trauma care should be linked to the ERSS system so that the citizen has to call only one number. And this number is for police, for fire, And this is also for ambulance and for emergency care. Linking with e-Sanjeevani system, linking with uh, telemedicine opportunities uh, during the transportation of the patient is another important element of the vision set out by our panels. Convergence with schemes such as ABPMJ for continuing care and for financial protection was highlighted. Our digital mission will play an important role in creating the digital system for this mission and also connect with Dhan Mantri Rahat, the program that has been recently announced is also an important element and important opportunity to ensure that the victims of road traffic accident have financial protection. So the ecosystem for emergency and trauma care at the district hospital is therefore visualized as a holistic, integrated, comprehensive, well coordinated uh, system, well coordinated ecosystem and paradigm through the suggestion that came up in from our multiple, very important multiple stakeholders at the session. Next one, please. Move to the last proceeding of the last session. This is with regard to Divyang Sahara Yojana. Uh, This is under para 86. So this is truly path-breaking. This particular budget announcement deals with timely access to high-quality assistive devices for eligible Divyangan as a as in multiple ways. And it is proposed to support the LMCO to scale up production of assistive devices, invest in R&D and integrate and AI integration. It also envisages strengthening of Pradhan Mantri Divyaksha Vyaushri Kendras and support setting up of assistive technology marts in a retail style centers where the beneficiaries can see, try, and purchase assistive devices and products. Next, please. Summary of discussions made 5 points. One, that we need to continue to hold stakeholder consultation with NGOs, startups, and manufacturers to strengthen the ecosystem for assistive technologies and their uptake, and strengthening of rehabilitation services in a holistic way. Second, and at the heart of this whole initiative is the strengthening of Alimco for producing essential ATs, more modern ATs, integration of AI into the assistive technologies, and indeed ensuring that these products are in larger number, go beyond the present capacity, and they are available for uptake in the country. So strengthening the ecosystem, but with expectations that there will be R&D, there will be AI integration, and there will be working together with the technology tie-ups and so on and so forth. One important uh, subcomponent of this initiative is a discussion that focused on how to enhance the footprint for Pradhan Mantri Divyang Vyaushri Kendras across the country. These are the kendras where assistive technologies are made available uh, or individually, chosen assistive technologies are made available. Currently, there are only 100 such centers. The aspiration is to quickly move to 300 to increase the footprint of this the supply system. And a part of the budget announcement was to create, through franchise model, a sister technology mart, which will be a one-stop place where people, the Divyangjan or the elderly, can go, they can pick up uh, specific assistive technology, they can try, they buy it. And what we need to ensure through this particular budget announcement related action is that there will be there will be quality products available there. There will be standard operating procedures through which the fitment and the quality care will be provided to the customer. This is the vision in the franchise model that they will unfold under the scheme. In order to develop collaboration with manufacturers, stakeholders, and startups to advance the initiative in the field of assistive technology. We will need to develop new specific projects. The whole idea is that we reimagine, re-energize an ecosystem, reach out to manufacturers, stakeholders, startups, researchers, and so on to create a new pipeline and new resource system for the Divyang to meet their assistive technology needs. Next slide, please. 5 areas for work as a way forward. Firstly, the LMCO system is required to have tie-ups with academia, manufacturers, the startup culture, and this will unfold in a systematic way so that we are looking at this institution being a more modern, forward-looking, and technologically enabled and updated institution. And this will require tie-ups. This will also require bullet number two, pillar number two, research and development working with industry, working with academic institution, new research to meet the assistive technology needs, novel AT products, as well as meeting eventually also through the larger ecosystem, the global needs in AT for which there is a huge scope. A specific expectation of this initiative is incorporation of AI related technologies into the AT or assisted technology products and ecosystem. This is one area on which AVICO would need to work with partners, and here the partnerships are solicited to work together with the government. We will also need to be supporting the centers of excellence. Elimco will work with centers of excellence for the work of innovation, for research and development, for testing, and there will be an offer to from the government to have centers of excellence participating in this particular area. The fifth and the final point is with regard to ensuring that there are more investments available through CSR mechanisms, specifically from central public sector enterprises and other sources, to be able to create a resource that can ensure that more and more of our the young citizens, the elderly citizens, can afford to have assistive technologies for their use, for the betterment of their life and the ease of their living. This expectation would feed into the utilization of the assistive technology production, manufacturing production at Limco to be able to reach the target beneficiaries, the individuals who need it most, and here support from CSR sources will be actively solicited and is expected. With these, uh, with this summary, the longish, I'm happy to submit my gratitude to the panelists, to the moderators of the 7 breakout sessions. This summary, we hope, is useful for our work together and for the way forward. Uh, Based on this, the respective ministries and departments will carve out the action pathway. We are beholden to the inputs of our panelists and participants of the 7 breakout sessions who actively contributed to very insightful inputs. Thank you very much for the opportunity. Jai Hind.
For a phenomenal and a very comprehensive summary of the outcomes of the breakout sessions. It was amazing the way you could capture all the points after discussion with our moderators. I would now like to invite Shri B.L. Barmaji, Minister of State for Ministry of Social Justice and Empowerment, for his remarks. Sir, in case you are, sir has joined, B.L. Barma, sir. Yes. There, there is muted. Sir, I'm muted.